This is a brief lecture on lysosomal storage diseases, but only on Fabry's disease. So first we're going to talk about what a lysosome is. So a lysosome is an intracellular organelle, and it contains a number of enzymes that are used to catabolize a number of different products, including proteins, nucleic acids, lipids, and complex carbohydrates. Each lysosomal enzyme reduces a particular macromolecule to its smaller component, and these smaller pieces can be eliminated from the body. So we're a lot greener than our cells, but what happens is whenever we're done with something, whether it be carbohydrates, lipids, nucleic acids, they're then sent to the lysosomes for breakdown, and then they're eliminated from the body. Defects, each one of these steps, whether it be for carbohydrates, lipids, nucleic acids, have a variety of enzymes involved. So defects in various enzymes in these pathways result in the accumulation of whatever they can't break down, whether it be proteins, carbohydrates, lipids, so on and so forth, within the lysosomes. And these large lysosomes then not only cause problems in breaking down whatever the other things are, for instance, if there's a problem with the breakdown of proteins or carbohydrates, then everything else that's supposed to get broken down there doesn't work right. And the lysosomes become larger and larger and almost really take over the cells. And this is actually an electron microscopy of a patient with lysosomal storage disease. And you can see these large, like these are the lysosomes, and they really kind of take over the function of the cell. As a group, there are over 40 different lysosomal storage diseases. Again, today is primarily only going to be dealing with Fabry's disease. Gene changes can result in a deficiency of a particular enzyme. The incidence of all lysosomal storage diseases put together is about 1 in 7,700. Just to put this in comparison, cystic fibrosis is about 1 in 3,000, and Down syndrome is about 1 in 700 to 1 in 1,000. So here is a graph of all the different lysosomal storage diseases. The most common is Gaucher's. Again, we will talk about this, but we're only going to be talking about Fabry's disease. So when to think about, in general, lysosomal storage disease, enlarged organs, unexplained joint stiffness, coarse facial features, this is more with a mucopolysaccharide disorder, pain in children or neuropathic pain, which is seen in Fabry's disease, and then some of the other storage diseases, you can have loss of cognitive developmental milestones. So in Fabry's disease, one of the things that we see is a very concerning family history. So here's a family history. The mother's 47 and she had an MI at 46. She has a sister who had a stroke at 44 and is now 53. And another sister who had a stroke at 42 and died of an MI at 45. The mother died of an MI at 56, and her brother, or the maternal uncle, died of a great uncle actually to this patient, died of renal failure at age 39. So either this is the worst luck family in the world, or there's something going on. And in this case, it's Fabry's disease. So what we see is we see early strokes, heart attacks, as well as renal failure. Fabry's disease occurs in about 1 in 40,000 individuals, and males often start showing signs of this disorder during early adolescence, although if we actually know what we're looking for, it's in early childhood. Symptoms include the inability to sweat, something called wirral keratopathy, pain in the hands and feet, and an unusual rash known as angiokeratoma. Fabry's disease is inherited in an X-linked pattern, but again, I do not like to use recessive, and we discussed this before. There's a difference between recessive and X-linked. Heterozygous females can have symptoms ranging from mild to severe, as is seen in the pedigree in the previous slide. What happens with females is, in some groups of cells, the enzyme is not working correctly, and so there can be accumulation. What happens in Fabry's disease is the enzyme alpha-galactosidase A is not working. It results in the deposition of globotransceramide in the vascular endothelium. Glycolipid deposits in the endothelial cells result in problems in the smooth muscle of blood vessels. So it causes ischemia. This obstruction from the glycolipid deposits causes ischemia to small capillaries. Where do we have the smallest capillaries? The kidney, the heart, and the brain. And so what happens is because of the accumulation of these glycolipids in the lysosomes, they're obstructing small capillaries. Clinical features of Fabry disease include angiokeratoma, and this is a picture of angiokeratoma. It's a non-blanching skin lesion. The inability to sweat, the reason for that is because they're having ischemia of the sweat glands. And again, this can happen as young as young children. Like 3, 4, 5, moms will say, you know, the boys can't play outside. They come in with a red face. And this results in intolerance to heat and cold because they don't have a way to monitor their temperature. And then acroparesthesia is tingling in the hands and feet. Cardiac abnormalities, left ventricular hypertrophy and mitral valve prolapse. The left ventricular hypertrophy occurs because of a lot of little teeny like ischemic events in the heart. And again, premature stroke. An ophthalmologic feature seen in Fabry's disease is something called whorl keratopathy, and here's a picture of this. This can sometimes be seen in females, and there have been, I've seen a number of carrier females that were brought to medical attention because of this finding by the ophthalmologist. It doesn't have any medical complications, but it is a finding. So, in childhood, intense pain, burning and tingling, impaired sweating, corneal clouding of this whirling, frequent fevers, heat and cold intolerance. By adolescence, they start seeing protein in the urine. Again, this is one of the later kidney issues. Stomach pain, diarrhea, nausea. A lot of the abdominal pain is probably a result of ischemia to the omentum that's covering the GI tract. And again, these kids are thought as malingers, you know, why are you feeling pain? You're not constipated, you know, it's not a problem. And then we start seeing the angiokeratoma, fatigue. By adulthood, that's when you start seeing the renal function decreasing, dizziness, stroke, cardiovascular complications, and then another later onset is ringing in the ears. As I stated earlier, many of the women with one abnormal copy of the gene for alpha-galactosidase have symptoms as severe as males. Renal failure can occur later than the male counterpart. However, heart disease, especially arrhythmias and early strokes, are more common in females. So again, the major problem is microvascular disease because of the ischemia. The occlusion of microvasculature of the kidney, heart, and brain. And but cardiovascular disease is the most common cause of death in both males and females. Often the renal disease can be treated with dialysis, and a lot of people that have renal disease also have cardiovascular disease, but it's been realized that the cardiovascular disease in males with Fabry's disease is actually part of the big system and not just a complication of the kidney disease. Enzyme replacement can be given every other week, and this improves neurologic symptoms, renal progression, and cardiovascular. So you can decrease the incidence of MIs and strokes by giving Fabrazyme, and this is to both males and females. Substrate reducer is another method that is currently not FDA approved, but I'm just going to mention it because it is something used in Gaucher's disease. It prevents making the product. So you don't make the glycotransceramide because you can't break it down. So whatever you have, hopefully if there's a little enzyme activity, that's enough to keep things even. These are oral medications, and in Gaucher's it's actually used. There are a number of medications in the pipeline for Fabry's, and hopefully by the time you start practicing medicine, we will have a couple. So the results, especially for Gaucher's disease, which I will talk about in the future, are very similar. So I don't have that information about Fabry's, but just wanted to mention it. And another thing is a chaperone. Again, we don't have these medications currently, but they are doing clinical trials. What it does is it affects the enzyme and changes the 3D structure. None of these will be on your exam as they are not FDA approved. So, in Fabry's disease, the most common cause of death in males and females is, and the correct answer is myocardial infarction. So that completes this brief review of Fabry's disease and what a lysosomal storage disease is.